I believe that science is unifying countries and people for a common good at a time when the world really needs this kind of solidarity. At the start of this pandemic, we did not know very much about COVID-19, and we really had to base a lot of our responses in the early days on what was known for other coronaviruses, in particular SARS and for MERS, for other human coronaviruses, for pandemic influenza. So half a year later, there's really a lot more that's known about this disease. The rate of discoveries, scientific discoveries about COVID-19 are unparalleled. We're learning so much every day. There are new vaccines being developed so quickly. There are new diagnostics, new digital tools for contact tracing, even best practices for healthcare workers in the way that they interact with their patients that they're caring for and with the public. These things are developing really rapidly in the evidence on them, and we learn more and more every day. We try to provide evidence to support very practical responses on things that are important to people's everyday lives. So these can be things like how temperature and season might impact the spread of the disease, or whether people can give COVID to their pets, how to make schools and workplaces safer to be in, whether air conditioning can impact the spread of disease. These are really important questions, and our guidance is really helping families and healthcare workers to protect themselves and each other, and to support local governments in locally targeted responses. Vaccines, therapeutics, diagnostics are a top priority for WHO and for its member countries. WHO has launched a global initiative to really accelerate the development of new vaccines that target COVID. And there are over 100 candidates that are currently being screened, tested, analyzed for this disease. It's a long process to develop a vaccine. The good news is that WHO, researchers, scientists, product developers, industry around the world are working together towards making this happen as fast as possible.